Well, the seemingly targeted killing of United Healthcare CEO Brian Thompson exposing the resentment toward our healthcare industry that is prevalent in the United States. With healthcare insurance costs soaring, some Americans are now asking if Obamacare is helping or hurting. Jim Kessler, former policy director for Democratic Senator Chuck Schumer, is with us, along with Jessica Anderson, former Office of Management and Budget Associate Director under Trump. So let me just look at this, first of all, from the 30,000-foot level, because Josh Shapiro, the governor of Pennsylvania, was talking about the idea yesterday that in some areas of the web, people are praising the shooter for what happened the other day in New York. Here's what he said. Listen here.
In some dark corners, this killer is being hailed as a hero. Hear me on this. He is no hero. The real hero in this story is the person who called 911 at McDonald's this morning.
All right. So we just learned, by the way, from the hearing that he is not fighting extradition. There is no bail granted. So it looks like he's going to be going to New York City. But keep in mind what Josh Shapiro said. But this incident has brought out in the public again the lingering resentment that a lot of people have with the health care in this country and the insurance industry and Obamacare, for that matter.
Yes, John, and I think it's actually incredibly saddening to see this part of American society react like this to this ruthless, unimaginable killing of really a man that's a father, he's a husband, he's a son, and there are proper ways to have a policy debate over health care. There are proper ways to talk about insurance reforms and cost of care. I mean, we heard on the election trail that the cost of health care was part of the complaints for the cost of living. So we know there are problems, but it's never okay to take a life to make a political stand. And that's what I think is so disappointing. And you saw leftist activists, not only online, but also on interviews on other networks the last 2 days, praising this, saying that it brings them joy. I mean, that is sickening, John.
Yeah, I saw that one person who said that. Gallup recently did a survey, Jim, on this. And look at this is how things have changed in the past 14 years. Americans on U.S. healthcare quality and coverage, 2024, 44% say it's excellent or good, compared to 62% back in 2010, which is when Obamacare was put into practice. So what's happened since then?
Well, Obamacare was never meant to make people love the insurance industry. It was meant to make people hate the insurance industry a little bit less, take care of things like pre-existing condition, put some cost caps on premiums and that sort of thing. Look, Donald Trump was elected in 2016. He said, I'm going to repeal and replace Obamacare. There was no plan to replace it. He had 4 years in the interim to say, I've got a plan to replace it. He's still saying repeal and replace. I think the homework is overdue. If you want to repeal and replace Obamacare, he's had 9 years to come up with a replacement plan. Let's see it.
Yeah, I mean, there's no question that we just keep kind of going along the same path that we've been going along for years and years. But here's what the Wall Street Journal editorial board member Alicia Finley wrote on Sunday. She said, quote, remember Barack Obama's promise that if you like your health plan and your doctor, you could keep them. Sorry. How about his claim that people with pre-existing conditions would be protected? Also not true. The biggest howler, however, was that health care would become more affordable.
Right.
The cost has just gone up, and up and up with no end in sight.
And that's what Americans are feeling. I mean, that's what puts us in such a desperate position. The cost, the access, the quality, the time it takes to get care for those that are most sick. And I really take issue with the fact that Obamacare was meant to only solve one part of the market. No, it was a one size fits all. I mean, that's how he talked about it, that this was going to fix everything. Well, now years later, it's more broken. Costs are higher. You definitely cannot keep the care that you had. I don't even have the same insurance provider that I had in 2010, let alone the same doctor. So a lot has changed. And I think if you thought 2016 was Trump being an agent of change, this election is even more so. And this new cabinet proves that he's going to take something like this serious.
Final word to you, Jim, real quick.
Well, repeal and replace. He's had 9 years to come up with a plan. Where's the replace? Homework is overdue.
All right. Well, we'll see what Bobby Kennedy has to do with it.
That's right.
Because he's coming at it from a whole new perspective. Jim, Jessica, thank you so much for being with us. Appreciate it.
Thanks for having me.
Thank you.
Sandra?